Dr. Joe Jacko?
Good. I'm doing great, Anthony. Thank you for having me.
Oh, it's a delight to have you on the show. I really look forward to this conversation.
Right.
Where are you joining us from?
I'm in Columbus, Ohio. Good old U.S.
Nice,
Yeah.
nice.
I guess 10 hours different from you.
Yes, indeed. Yep. So you're hitting dinner time, and we've just had breakfast.
That's right.
Yeah. So please bring the listeners up to speed with how you've arrived at what you're doing today.
Okay, so I did an internal medicine residency here in the U.S. and I kind of got a little frustrated just kind of giving people medications, and I gravitated to preventive medicine. My first position after training was actually at the Cooper Clinic in Dallas, and Dr. Ken Cooper's pretty well known. He coined the word aerobics and started this big preventive health center in Dallas. And so I did that for a period of time, but a bulk of my career has been working with athletes. And when you're dealing with athletes, the focus is on optimal health, optimal function. And then after about 20 years of doing that, I kind of got interested in men's health, which I thought kind of coincided with the sports medicine, particularly for the older athlete, the senior athlete. I think they complement each other. And it was during that time that I really began to see more about, at least here in the United States, how the FDA works, and I think some of the obstacles and some of the way things are misrepresented to physicians. I then joined a large primary care practice here in Columbus, and I ended up doing a lot of internal medicine, and I was trying to do some men's health. And then, kind of COVID came along, and it just seemed like there was a better way than just dispensing drugs to patients. So I kind of come back now to preventive medicine, a lot of exercise and exercise and nutrition. So really my career has come full circle, and this is much better. There's, medicine, I think, is a great profession. But it's kind of lost its way, I think. Too much emphasis on medications. We kind of forget about the basic fundamentals of health.
Yeah, so let's go into these basic fundamentals, this preventative side, because certainly the listeners are really interested, and that's why they listen to this podcast. Is that they want to improve their health, they want to take it to the next level. So, what are the foundations of preventative, or optimal healthcare, essentially?
Well, the main foundations are going to be nutrition and exercise. And, some of the basic things your grandmother probably told you: sleep well, I think a real big one is having a purpose in life. And I think we've developed this society. Everybody wants the shortcut. And I don't know, I'm not sure if you're familiar with Dan Buettner's work. He's spoken about the blue zones. And, and you think about it, you have people across the globe, living to 100 years old, and they don't know anything about science. They're just living life, and they're growing their own food. They're active. They're not necessarily on a structured exercise program, but they're constantly moving. As they get older, they're a part of the community. They're well respected. And so I think there's a lot of things along those lines that we overlook, and we're trying to find a shortcut, the drug, the surgery. And, we just need to get back to the very fundamentals of good health.
Yes, this real impatient approach to life. Like, it's so busy, so wanting to do the next thing or achieve the next result, as opposed to being really present and living the moment. Yeah.
Right.
And
yeah, at least in here, you guys may be a little bit more laid back down under, but we're pretty tight people up here in the U.S. Everybody's just on a treadmill here, and it's going nowhere for a lot of us.
Well, it's true. And like they're on the treadmill, and they're unhappy on the treadmill.
Right.
They're looking for something else, and they're looking for the next shortcut, right? So, like, I know, a lot of what you're doing around, in your field of work now is around, the longevity and and supporting that. And again, I find the longevity market very much it's a pill market, right? It's
yeah, it's getting that way.
Yeah,
I mean, there's a lot of good research, and and I have patients, they want the pill that might help them live an extra year or two, but they're at the same time, their diet's unhealthy. They're just forgetting the basics, and it doesn't really make sense to me. So, a lot of to practice medicine well, it really takes a lot of time and education. And unfortunately, a lot of times you just don't have the time to do that in the office setting. So, like in our office now, we have exercise physiologists, we have a dietitian, we have personal trainers, we have a 60,000 square foot facility that's kind of all one shop. We have a lot of recovery things with hot tubs and cold plunges and things, red light therapy even. Yeah, so it's kind of a more comprehensive approach, and it's a lot more fun, and patients get better results, I think.
Yeah, 100%. But the approach of your clinic is very much, you've got this suite of, like, say, tools and support things for someone's health and well-being, but you're very much picking what's most supportive in terms of where they're at and where they want to get to, right? It's
right. Yeah, the first thing you got to do is find out what the goal of the patient is, and find out what their concerns. And to me, I always have looked at the doctor-patient relationship as a partnership. I'm here to help you to get where you want to go. And that seems to be a concept that isn't real common these days. It's kind of like here, at least in the United States, I'm the doctor, you're the patient, you're going to do what I tell you. And we forget the patient has a say in what they want out of their health. And they also have a say in how we achieve it. Now, as a physician, doesn't mean I just do what you want, but I need to listen to your concerns and your desires. So the first thing we do is try to get assessment of their goals. And then we do a physical, collect some baseline data. Here's where you are, here's where you want to go. And then we map out a plan to get them from A to B.
Yeah, so it's a very personalized approach.
Oh, yeah.
Yeah, that is helping them in a direction that they want to go in. And that's different for everyone, right? It's a unique journey. Yeah.
Right. Everybody's different, and everybody's got some people have pre-existing conditions that you have to take into account. You might have to move slower on some. And then you have different motivation levels too.
Yeah, the motivations, and you just touched on this, I guess, a bit earlier, around one of the most important things is having a purpose in life. And obviously Dan Buettner's work reveals that, right? In terms of, yeah. So, and like the purpose really links in strongly with motivation, like a purpose for living, and hence it drives the motivation to, yeah.
Right. You have to know who you are and why you're here. And once you know that, everything kind of falls in place. You know what to say yes to, you know what to say no to. And, you got to have a really strong reason for getting up in the morning. And I've had patients who I think having a purpose overcomes some bad health habits. I think if I remember a patient years ago, he's about 75, he was overweight, blood pressure was a little high, but he ran a factory, 300 employees. He was walking 4 or 5 miles a day, and he had 300 people dependent on him. And that's what kept him going. That's what kept him, kept him motivated, basically. Yeah.
Yeah, absolutely. It's that, I guess wanting to do, like, it's beyond yourself, right? It's in order for me to help others, I need to be in a good state of health. And so and it's the same as like those that want to be around for their children and help them and mentor and guide them through life, that, they've got a purpose to do that. And it's, I guess the same for your clients was, the strong.
Yeah, I remember one patient, she was 62, and this was like 1990 at the Cooper Clinic. An exam was $2,400 US. That was a lot of money. And through a series of unforeseen circumstances, she became her grandson's custodian, and really the only person he had left in his life. And I mean, she said, I have to stay healthy. I'm the only thing this child has. And so that was a tremendous motivating factor for her. And unfortunately, it takes those types of events, or you have to have the heart attack first, or the cancer diagnosis, before you really begin to change things. And, it's a shame that happens to too many people.
Yeah, and in a sense, it's that wake up call, but it's that as you much prefer them to take a preventative approach, but some people just that's what they need in order, in order to move forward.
Yeah, and I think some of it depends on the education system. And here in the United States, there's less emphasis on physical education. Now, I do think at least the athletes, the high school athletes, they get far better training, or education and nutrition than I did when I was in high school. Like there was no, you just ate what you wanted to. But now some of these kids are really disciplined and they eat very cleanly. But once you get outside that athletic realm, it's quite a different story.
Well, like the athletes have a purpose to eat cleanly, don't they? Because they want a result, right? Whereas,
All right.
yeah. So if you're not the athlete, then like I think it's harder to eat well, given we're surrounded by, I guess, fast food and convenient food and food that really turns on our salivary glands and gets us all excited. Yeah, so but I think it's coming back to that, having that purpose. The athlete's got the purpose, and it drives that motivation to eat well. Because if without that, then it's much harder.
Oh, you look at the athletes at the Olympic level, how they keep breaking these records. It's like at some point you think it has to end, but I think a lot of it is better nutrition and better recovery too. And sometimes we forget that you have to have enough time to recover from your exercise session or your training session. You just can't keep hitting it 100 miles an hour every day. You need the body needs a little bit of a break every once in a while.
100%. You like the recovery is just as important as the training.
And maybe sometimes even more important, because that's where all the physiologic changes occurs when you're sleeping and at rest.
Yeah. That's true, isn't it? Yeah, and even the neurological wiring, in terms of learning new sequences and new strategies and stuff like that. In order, you need to have a good night's sleep in order for those neurons to connect and stay connected. But yeah, so in terms of, we've touched on the foundations, nutrition, exercise, sleep. Around the nutrition side of things, what's the starting point for someone? Like, so for someone that is looking to take their level to or health to the next level, where would you suggest they start? Because nutrition can be very overwhelming. There's people, all these. Yeah.
And I don't think there's a right plan for everybody. I think some of it's genetic and kind of your preference, but I think a good starting point is, you have to go back to our ancestors. They did not have this 24/7 hour a day access to food. And we have food, with the snap of a finger, we can have something. And so you got to understand why you eat. Like I personally am a boredom eater. If I have nothing to do, I'm picking at something. So you have to understand what your triggers are. But I think some real simple principles are like when you go shopping, shop the perimeter of the grocery market. That's where you can find the freshest food, the whole foods that don't have a lot of ingredients and additives to it. As much as possible, avoid things that come in a bag, box, can, or jar. Now that's really difficult and you're not going to be able to do it entirely, but those foods have a lot of sugars, and sugar goes by a lot of different names. If it runs across the ground, flies in the air, swims in the ocean, falls from a tree, it's probably safe to eat. And so you want to eat things in their most natural state. And really the freshest whole foods and fresh foods are better. Now, here everybody relies on supermarkets and who knows how the food's been grown and the pesticides have been used. And you look at cattle and poultry, they're just loaded up with hormones and antibiotics. Yeah. Here in the United States, 2/3 of the antibiotics are used in the livestock industry. It's not from us prescribing them.
Wow.
And then you're consuming that, and then that affects your gut flora, and that affects everything else practically. So.
Yeah, so it's quite simple. Like in terms of what you're saying, it's shop the perimeter, eat as fresh as possible, less processed, less packaged, and that's a good starting point.
Yeah, and then it depends on the person's need. If someone's coming in and like American football player, they're trying to add some muscle mass, then that you need a diet that's got adequate protein, and then you have to couple that with a appropriate training program. And then if someone's losing weight, obviously you want to lose fat, not muscle. And so sometimes you got to do it in a stepwise. You lose 10 pounds. Well, you probably lost 2 pounds of muscle. So you got to put the muscle back on, then you got to lose more, then you put the muscle back on. And so it's a little bit of it's as much of an art as it is a science. But here, one thing that a lot of people don't know is, like, at least here in the US, the food labels, there's a 20% variance. They're allowed a 20% variance. So if it says 100 calories, it may be 120. If it says, 20 grams of protein, it may only be 16. So those things that are desirable are overinflated, and those things undesirable are understated. So it really makes, counting calories a little bit more challenging than it would appear to be.
Yeah, absolutely. 20% variance is huge.
Yeah, it's huge.
It's massive. Okay.
Yeah.
I can
several pounds over the course.
Yeah. Totally. It's like very misleading in a sense, 20%. I can understand 2%, but I can't get my head around 20. And
20.
Yeah, it's just, it allows for manipulation and in the advantage of these, not the consumer, but yeah.
Right. I think the other thing too is we got to get to a point where you can look at a plate of food and just say, this is healthy. It's kind of like learning a language. When you learn a language, at some point you got to quit translating it back into English. You got to just appreciate it for what it says. And so you got to be able to look at a plate and say, yeah, this has a healthy portion of protein. This has a healthy portion of fats, or vegetables, and some starches. But so you got to kind of appreciate that.
And what does Dr. Jacko's plate look like in terms of, like, if just the portion, like, take a plate size, and how much is protein, how much is starch, and how much is the vegetables?
Well, your fist is about 3 or 4 ounces of protein, so that's good. It should be probably 2/3 green leafy vegetables, the protein, and then a starch. I think you have to be. I usually recommend avoiding the white stuff, the white potatoes, white rice, white pasta, white bread. But also it's how you pair the foods too. If you the way it affects your insulin response depends on how you pair food. You go to a restaurant, the first thing you do is give you bread. Well, that shoots your sugar and your insulin way up. That should be the last thing they give you. They should really start, with your main course and work backwards. So
what's interesting is when I've traveled the world and I go to places that aren't so westernized, that is how they do it. Like when I first visited China, and this is in the 1990s, I was in China. And so it hadn't been, hadn't had this huge Western influence. And they would exactly do that. They would serve all the main dishes, and at the end, the very end, the rice would come out, right?
Oh, okay.
Yeah. So you had your protein, you had all your vegetables, and then at the end, the rice would come out. But in the Western, Asian restaurants, it's the rice. It's the rice, and then you add all that. Yeah. So I've actually found through my travels that what you're sharing in terms of the way it should be is traditionally way back how it used to be.
Yeah.
I
think it would be helpful. You all have continuous glucose monitors, I assume.
Yes, we do.
Yeah, so I think it would be helpful for everybody to have one of those for a month, and you experiment. And most diabetics will tell you they eat a baked potato, and the sugar just does that. But if you ate a protein and then the sugar, you would see a less of a response. So it's how you pair the foods is also important as to what you're actually eating, and the sequence of how you eat it too.
Yeah. And so what you're recommending there is to eat the protein first, and then the starch or the carbohydrates.
Yeah, protein and a healthy fat, because that's going to give you a sense of satiety. You'll have a sense of fullness, and then as Dan Buettner did in the Blue Zone, some of them they have that you quit at 80% full. that was, I think, the Okinawans' habit. You don't want to leave stuffed. You want to leave content, but you could still, go out and physically do something. So we tend to overeat, basically.
And it's true, because that's how they live, right? Because when they eat, straight afterwards, they're back to work, like in the fields. And so
Right.
when you're doing that physical work, it's very hard to do when you're totally stuffed, right? Yeah. Like, I guess that's a motivating factor as well. And whereas the modern lifestyle is that you can have a big lunch and you just go back to the computer.
Right.
It's like, fall asleep at the computer.
Yeah, there's been studies that after you eat dinner, if you can go for a 20 to 30-minute walk, it really significantly improves your insulin and your glucose tolerance, your glucose levels. And most of us, we eat and then we're on the couch watching the news or something.
Yeah. Absolutely. So that's another great tip is after eating, do some movement. Go for a walk.
So a walk. You may not want to run or swim, but at least go for a walk.
Right. Yeah. Nice. And that's a great way of regulating the blood glucose. So you've got your fist of protein. 2/3 leafy greens, a few starchy, but not the white starches.
Right.
Healthy fats. Talk to the healthy fats. Yeah.
Avocado, olive oil. Sometimes I'll just take it doesn't sound appetizing, but usually I do a tablespoon of olive oil. And then for a salad, I usually use oil and vinegar rather than the commercial stuff, which typically has a lot of sugar in it or additives too. The other thing I think is healthy, and what I've been doing the last few months is I do a 3-day fast. Now I will allow myself a couple hundred calories if I really break down, but what I find is I'm less hungry on the days I'm not fasting, and I get filled up easier. For me, for dinner, many times a salad and a bowl of soup is all I have. Now, if I worked out that day, I make sure I get some protein after a workout. But I think it has the same effect of these weight loss drugs, the GLP-1s, that once you do that a little bit, your stomach kind of shrinks. You just feel fuller sooner. Yeah.
Yeah. So fasting, you're a big advocate for. There's so many.
There's
Yeah.
obviously you got to be, you got to take into account a patient's medical thing or there's a situation. But I think it has a role. Maybe 3 days isn't necessary for everybody, at least maybe one day, or, there's the intermittent fasting, or maybe you skip breakfast and lunch and then just eat a good dinner. And you don't have to do that every day, but that kind of helps. There's these two, what you call your AMPK and your mTOR, which you probably know. You want to shut off the mTOR, which is tissue building and leads to obesity and cancer and those types of things. So by fasting, you kind of reverse that. You shut the mTOR off and you kind of clear out the dead cells in your body or the non-functional cells. Yeah.
And traditionally, we wouldn't have had. I guess
we
look at the
our ancestors didn't have to do that.
Because they just had there was no food around them, right? and then the temptation's not there as well. But you look at the modern world; it's sort of like you're fasting, and then you walk past this place, and it's got this beautiful waft of smell coming out, and then straight away you get hungry, or you watch other people; they're all eating around you, and so it's certainly much harder in today's modern world with all the food we have around us.
Yeah. And one thing I learned recently, the tobacco industry, they were masters at making things addictive. They have, like in the 80s and 90s, they started buying up a lot of the food companies. And so, the food's designed to make you hungrier.
Yeah,
so at least the processed stuff is.
Yes, absolutely. They've got food scientists there coming up with the most perfect ratios of fat and sugars to drive that appetite. And absolutely. So exercise, we haven't touched on exercise. what do you suggest around the exercise front, as opposed, like a starting point, for someone?
Well, okay. So for someone who's totally starting off fresh, I would recommend a walking program first, and 3 or 4 days a week for maybe 30 minutes, build up to 30 minutes, then go to 40 minutes, and then pick up the pace. And then once they feel comfortable with that, maybe branch out. I mean, first of all, you have to find something they enjoy doing. Like, I hate running. I'm not going to run, but I could go on a bike and I could do a stair climber. Okay. Probably the thing we neglect most is flexibility.
Right.
You can only build strength. You can only build endurance within the range you have motion. And as we get older, as you get stiffer. Okay. So flexibility is real important. And then you do have to do some strength training and resistance training. There's obviously different programs for that, but the more muscle you have, muscle is more metabolically active, like 2 to 3 times more active than fat. So even when you're doing nothing, your muscle tissue is burning up calories at a faster rate. And so you do have to incorporate some weight training. And now it doesn't have to, you don't have to necessarily go to gym, but calisthenics, push-ups, dips, chin-ups, things you can do at home, or doing it at your desk at work even. So, I mean, that's kind of in a broad stroke, but again, it kind of depends on what you need. And obviously it depends on if you have any existing orthopedic, problems too.
Sure. Yes.
Yeah.
So
but the other thing too is, at work, you just, take that, you got to get away from the sitting. So the standing desk is helpful. Yeah. Our jobs are so sedentary that we have to exercise. The blue zone people and our ancestors didn't have to exercise. They were just naturally active. So for us, it takes some thought and planning to do that. Yeah.
Yeah. It requires the effort. It requires, that motivation to actually do something. It's, So I get it. Our environment, the modern lifestyle is certainly more challenging for us. Yeah.
Right.
Is. Yeah.
Very challenging. Right.
Yeah. Yeah. And also on the sleep front. So obviously our ancestors, or, tradition, back, that there wasn't electricity. Now there's electricity. And now we've got all these games and devices and Wi-Fi and internet and technology. And so, what are your, foundations for sleep?
Well, personally, for me, that has not been an issue. I fall asleep within a couple of minutes, and I probably break a lot of the rules because I'm up on the computer late at night. But it helps to get away from the screen. Maybe a warm bath and just some reading or meditation, or whatever kind of stress thing that you find helpful is important. You got to cast aside any worries that you have. We're all preoccupied, and that's obviously easier said than done. Avoid caffeine late at night. Keep the temperature of your room kind of on the cooler side. That typically helps. And then I think just having a consistent schedule. Mm-hmm. I think most people, even when they retire, they get up at the same time, even they don't have to go to work. It may be 6 o'clock in the morning or 5:30, and then set time to go to bed. And maybe you shift it a half hour on the weekend or something, but you got to get into I think it's important to have a regular routine. Then for a lot of people who are overweight, sleep apnea is a huge problem. It's probably, we know it's big, but it's probably even bigger than we realize.
Fantastic.
Yeah. What's that?
Yeah, no.
The testing.
Good. Yeah. No.
Yeah, the important thing about sleep is that's when your growth hormones being released. A lot of your circadian rhythm, a lot of these rejuvenative hormones are being released, and so if you're not getting a good night's sleep, and sometimes these sleep aids, they put you to sleep, but you don't get that really deep sleep. And so I don't really like prescribing, medications for that, but sometimes you have to.
Yeah.
Melatonin can be helpful, but it's just hard to find the right dose, and some people just don't respond to it. But I think if you just have a naturally active day, I think it's easier to fall asleep.
Very true. Very true.
Yeah.
So gets back to being more active
Right.
during the day and eating good food,
Mhm.
and then as you said, having that routine that's supportive of the winding down. So
Right.
that helps the body and the nervous system calm down and get a restorative night's sleep. Is there anything else you like to add to the foundations of good health and optimization?
Well, stress management's a big thing. And a lot of times, I think it can be helpful to get some help with a counselor, try to understand why you're stressed. There's a lot of work stress. There's a lot of stress at home. And, it affects all of us to one degree or another. And you just got to kind of come up with a strategy, find out. And that's where I think if you have a purpose, you know what's important in your life, you know what to say yes to. No is a very helpful word. You don't want to, I think a lot of us are people pleasers. You want to say yes to everybody. You can't do that. You got to have some guidelines and some boundaries.
Boundaries. Because it really protects your health, doesn't it? Ultimately.
Oh yeah. Right.
Yeah.
You're not doing anybody good if you're not healthy yourself.
Yeah. Awesome. I really appreciate this conversation, Dr. Joe Jacko. How can the listeners best connect with you?
Yeah, I have a website. It's www.jackomd180.com. So there's about 1,100 articles that have been written. There's at least one ebook that you can get for free. There should be another one coming up pretty soon. So that would be the main way to read more about what I do. And, these articles have been written over 12 years. And I kind of go back and revise some of them. Some of the more recent articles have to do with, kind of a touchy subject of vaccines and medical freedom and patients not having the right to choose their treatment. And also, I don't know, I wrote a book too.
Yeah. So tell us about the book.
Yeah, it's called Bamboozled, Duped, and Hoodwinked. If you don't mind, I'll show it here. And so it's about the tricks and the deceptions and half truths of the medical profession. Kind of, I hate to say it, but it's not true, a very honest profession at times. And so patients, you really need to, or listeners need to really do their own research. A lot of things the whole field's been corporatized, been taken over by big corporations. Their emphasis is on making a profit, and getting lost in that equation is the patient and the physician. Here in the United States, we got like 160 bureaucracies that get in the way of that thing somehow. So anyway, the book talks about that and how some of the research is a little tainted and not all that honest.
And is the 180 in your website? Just talk to the significance of that.
It's my way of saying we got to do a reversal with the way we're going.
Okay, so we've got to get back to more traditional practices.
Practices, right?
Yeah,
and get back to the foundations that we spent a lot of time talking about here. Right.
Awesome. Yeah. No, very insightful. I really appreciate this conversation, Dr. Joe Jacko. And to the listeners, please reach out and connect with Dr. Joe Jacko. Check out his website, read the articles, get enlightened and educated in the field of empowerment, and really take control of your health. If you want to obviously connect with Dr. Joe Jacko, you can do via his website, and and further stay connected and up to date with everything that's going on in the health and wellness world. So thank you once again, Dr. Joe Jacko.
Thank you, Anthony. I appreciate it.
You're welcome. Thank you.
Okay. Take care.